So today we will be talking about hypertension, and more specifically we will be talking about the prevalence of hypertension in diabetes. So according to the Oxford Online Dictionary, blood pressure is defined as the pressure exerted by blood on the walls of blood vessels, especially the systematic arteries. So unusually high blood pressure, which is called hypertension, is a condition in which the heart is required to pump more blood into each artery because of the increase in blood pressure. This illness obviously strains the heart and thus can lead to severe problems such as heart disease and strokes. There are two types of hypertension. The first is known as primary or essential hypertension, and the cause for it has not yet been discovered. And the second type of hypertension, which we will be focusing more on, is known as secondary hypertension, and it is brought upon by another condition that the person has. Diabetes, causes of secondary hypertension, has led to nearly 70 million infections nationwide and nearly doubles the chances of one to obtaining this disease. Although the chances of developing diabetes from hypertension is not as high, it is still prevalent. When both diseases are present, they tend to increase the potency of each other, which complicates situations even further. However, the severity of the combined effects of diabetes and hypertension are linked together more than just by mere chance. Several factors such as age, weight, and even race play a part in the two diseases. Obviously, bad habits such as excessive eating, lack of exercise, consuming a bunch of alcohol play a crucial role in the forming of not only hypertension but also diabetes. But in the case of those who are already diabetic but maintain a relatively healthy lifestyle, there are other causes to hypertension. And in order to find a more in-depth correlation between the forming of each other, scientists have made numerous studies. In one study of 1,077 type 2 diabetics in Malaysia, research has shown that education, BMI or body mass index, and age played a huge part in the uncontrolled hypertension that one had to go through. Those who were illiterate or less educated had a 1.29% higher chance of uncontrolled hypertension than those who were more educated. Those with a higher BMI of greater than 23 kilograms per meter squared had a 1.3% higher chance of uncontrolled hypertension than those with a lower BMI of less than 23 kilograms per meter squared. And finally, those above 35, 50, and 60 years old had a higher chance of uncontrolled hypertension by 1.99%, 2.66%, and 3.27% times respectively. Overall, this particular study showed that hypertension grew in nearly 92.7% of type 2 diabetics. However, in similar studies in other countries, the research conducted showed different statistics. A study conducted in Taiwan, for example, shows that the link is significantly less with the chances of diabetics growing in type 2 diabetics by only 30.9%. The reasoning behind this huge difference in data was definitely caused by the different methods of how the study was conducted and potentially the different races that were in the study as well. Other factors to consider were environmental conditions. For example, another study showed that someone with an African descent had a higher chance of receiving hypertension when consuming alcohol than someone of another race. Another reason for such unreasonable differences was in part caused by the fact that the subjects in the Malaysian test were diagnosed with diabetes for more than 10 years, as opposed to the more varying condition of type 2 diabetes that the subjects in Taiwan had. In the same Taiwanese test, it has been found that the prevalence of hypertension in diabetics grew steadily from the years 2000 to 2009. while in another study, also conducted in Taiwan, there has been significant data backing up the increased prevalence in men at 9.3%, whereas women were only at 6.4%. All of these studies have led to different results, which show that there are way more factors that need to be put into consideration in order to more accurately represent the overall population. Although the studies focused on a certain population of people, for example, restricting the data to only type 2 diabetics and the race of people who were studied, it allows researchers and scientists to better understand the pattern of prevalence of hypertension in diabetes. So why are these studies so important? Even if the worldwide population was not accurately portrayed and only countries from Asia were studied in the studies that I have shown, the data found could further lead to more discoveries on the prevention of the two diseases, and scientists will come closer in researching ways to prevent those two diseases from coming together. Even though the study shows limited data, thus potentially making the data less useful as it could have been, it is still often referenced for the crucial data that have been found or that have soon to be found. These small steps could later lead to bigger discoveries that could lead to the end of both diseases. Well, what can we currently do to try to reduce the risks of obtaining these diseases? For starters, those not on medication need to make sure that they are on a well-balanced diet and exercise regularly. Generally, for men, they should keep their waist measurements less than 40 inches, whereas for women, they should keep their waist measurements less than 35 inches. One should exercise daily for about 30 to 60 minutes, and obviously the less sodium that one consumes, the better. As for alcohol, although small amounts can reduce blood pressure, too much alcohol consumption can definitely be harmful. So if one was to consume alcohol, they need to make a plan so that they do not consume a lot of alcohol. The same goes for stress. Although a small dosage of stress is proved to be healthy, too much can increase blood pressure. In addition to all the negative that tobacco brings, it also increases blood pressure, so if you are a frequent smoker, the blood level will frequently be higher than normal, which would not help the hypertension. Those who maintain healthy lifestyles still have the possibility of obtaining hypertension or diabetes. Some ways to spot hypertension is by experiencing severe headaches, anxiety, shortness of breath, and nosebleeds. People who are diagnosed with prehypertension could take medications to reduce blood pressure levels. Research has definitely come a long way, and it is definitely possible to find cures for both of these diseases. Even if the permanent solution to either hypertension or diabetes do not come up in the near future, there will be, without a doubt, a temporary cure to those who have obtained these diseases. With the research that we have today, scientists will surely be able to progress in finding the cure to one of the most potent diseases worldwide. All we have to do now is hope that further researches will only help this cause. Thank you.